Welcome to another inspiring episode of Without Regret, the podcast. I'm your host, Tamara. May is Mental Health Awareness Month, and today I'm so excited to have an exceptional guest, Dr. James Flowers. Dr. Flowers grew up in a home marked by addiction, stepping into an adult role at a young age after the sudden loss of his father. This early responsibility and the subsequent loss of one of his twin sisters to cancer profoundly shaped his life path. Initially pursuing a degree in marketing and finance, Dr. Flowers changed course to align his education with his values and passion for helping others. His journey led him to the Betty Ford Clinic, where he honed his expertise in addiction recovery. With a distinguished career at several prestigious institutions, he eventually founded the J. Flowers Health Institute in Houston, Texas. The institute is renowned for its unique, complex, and comprehensive approach to recovery. In addition to his clinical work, Dr. Flowers is the host of the podcast, Understanding the Human Condition, where he delves into the complexities of mental health and addiction with experts in the field. Join us as we explore his remarkable story and the unique insights he brings to the table in our discussion today. Please help me welcome Dr. James Flowers. All right, thank you so much. Welcome to Dr. J. Flowers. James Flowers. Should I call you Dr. Flowers?
You know what? You can introduce me as Dr. Flowers and then call me James. How about that?
Okay, sounds great. Great. Well, thank you so much for being here with me today. And let's just start a little bit with your background and kind of talk about, actually, I want to do something a little bit different this time because I want to start out by saying who you are today. Who are you today? And then let's go back and talk a little bit about where you came from.
Sure, you bet. Absolutely. So who am I today? I think that I am, I would put myself out there and just say I am just a average struggling person in this world, just like everybody else. And we all have our ups and downs in life. And I am someone that helps others. I'm someone that gives back. I'm someone that loves deeply. I love my career and I have a passion for what I do. And so J. Flowers Health Institute is my passion that I created 5 years ago to really help other people overcome serious mental health, complex mental health, addiction, unknown medical issues, or complex medical issues. And some of my patients have one of those things, and some of my patients have all of those things mixed in. And so I believe in my current life, and what we do and what I do is looking at the human system from a 360-degree circle, not just the brain when someone is depressed, or not just a body part when they're hurting or have chronic pain, or not just family when they're having a family or a crisis with a marriage or something like that. I think that when we evaluate the total life of a human being in this 360-degree view, that then you're working with a comprehensive team and a multidisciplinary team, that we can really find a true, clear set of diagnoses and develop a proper treatment plan and really a roadmap for health and how to move forward in your life and thrive and do what you want to do in your life. And so who am I today? I'm someone that created a program to help people from around the world overcome complex issues in life and overcome a crisis state of mind and really thrive in life.
Awesome. That's pretty fantastic. I would hardly call that ordinary or regular. I think it's pretty extraordinary.
Thank you.
Yeah. You're welcome. Okay, so now let's talk about where you came from in your childhood and what you had to overcome yourself.
Yeah. I come from an interesting background, and I really do believe, or I know, that the reason I do what I do today is because of my background and because of the trauma that I overcame as an adult from being a child of an alcoholic or alcoholics, coming from a very dysfunctional family, coming from a mother who had mental health issues, depression, anxiety, grief, trauma, from her own childhood. And she was really addicted in the 70s, is when I was growing up. She was addicted to Valium, and she loved her alcohol in the evening. And my father was a workaholic alcoholic. And I was the youngest of four children. I had an oldest sister, then I had twin sisters in the middle, and then I was the youngest boy. And my mother had had twin boys that died at birth, prior to my oldest sister being born. And so my mom came from a childhood of her own trauma and her own background. And then as she married my father, she was a dysfunctional relationship with my dad. And they really partied and drank alcohol and used prescription medication to mask their own trauma from their childhood. And so uh, growing up, I really remember being about 8 years old and looking at my oldest sister, who was 10 years older than me. She was also a drug addict and an alcoholic, and looking at her, and then looking at my mom and dad, looking at my grandfather, who was a prescription drug abuser as a physician, and going, I don't want to be like this. I felt like I was watching a movie going, this is a horror story, and I don't want to grow up and be like any of these people. I want to grow up and be something very different. And so as I grew up, and that was 8 years old. And then when I was 10 years old, my dad had driven my sister to treatment for the very first time, her first treatment attempt at recovery, and drove her from deep South Texas into Dallas, Texas, to a treatment center, dropped her off, and drove back to South Texas where we lived. And he came home, and he got home about 6 or 7 in the evening, and we sat down at our dinner table. And it was my mom at one end of the table, my dad at this end of the table. I was next to him, and my twin sisters across from me. And we were just eating dinner, having a conversation. And all of a sudden, my father looked over at me and grabbed his chest and fell over and died right in front of me. And we just were frozen. My mother was frozen. My sisters were frozen. I was kind of frozen, looking at my father on the floor right next to me. And I thought, is he drunk or is he dead? And I
Oh,
know I'm
yeah.
laughing, but that's probably my trauma response and making me laugh. But as you can imagine, a 10-year-old seeing his father dead next to him, and then my mother getting up and going, well, shit, what are we going to do now? And then my sister's going, oh my gosh, what just happened? And finally someone picking up the phone and calling an ambulance and coming out. And my grandfather, they took my father to the hospital where my grandfather was actually on call that night. And so when they brought my father in, my grandfather opened his chest and tried to save his own son's life.
Oh
And
my
uh,
goodness.
and obviously he was already dead, and so he wasn't able to save his life. But after my father died at 10 years old, I continued to live with a dysfunctional mother who had never balanced a checkbook, had never paid a bill in her life, had never really done anything to take care of herself in a adult independent way, because she was always taken care of by my father or other people. And so she was as lost as I was at 10 years old. And by the time I was 11, I was teaching my mother how to balance her checkbook and look at the finances and pay the bills. And I literally would write the checks out for my mother, and she would sign them, and I'd go pay the electric bill at 11 years old. And she had a dysfunctional relationship with my sisters. They were at the time, I think, 16, 17. And so they were, coming into their own, but yet very rebellious and very angry at my mother and very angry at not having a father. And so they began to drink and party a lot. And so it was just a constant turbulence in my home. And my escape was every day at lunch. My grandmother and my grandfather lived about 3 blocks from my elementary school and middle school. And I at lunch would go to my grandparents' house and sit with my grandmother and have just an amazing, wonderful, peaceful conversation. And we would eat lunch together every day during school. And then I would finish lunch and walk back to school. And obviously, I grew up in this very small town where you could leave school and go home and eat lunch and come back. And but that was my peace. And as dysfunctional as my mother was, she always told me, James, you need to know that you can do anything in life that you want to do. And if you can visualize it, you can achieve it. And if you can imagine it, you can make it happen. And my grandmother would reiterate that to me and say to me, you can do anything you want. And then she would also always add, she said, but whatever you do, you should do something that you can always go be a teacher. If something fails, you can always go teach school. And so obviously I can go teach at a university if I want, but at this point, but and may do that one day in my retirement years, which I think would be a lot of fun. But as I continued to grow in this turbulence and with a dysfunctional mother and a dysfunctional family and all the death that was happening around me, my mother's parents both died of cirrhosis of the liver from alcoholism when I was 12, I believe, and they died within a year of each other. And then I went into high school and life was somewhat more normal and smaller waves of emotions, but not these huge ups and downs in my family. And then my freshman year of college, one of my sisters, the twins, was diagnosed with cancer. And so with her cancer diagnosis came surgeries and chemotherapy, and she developed a chronic pain syndrome from chemotherapy because chemotherapy will it kind of burns the nerve endings, right, when it's working on your body to kill the cancer. And so she developed chronic pain and then eventually died as well. And I was sitting next to her holding her hand the morning that she died. And then exactly 1 year later, my oldest sister, who had been the one that went to treatment when I was 10, had gone to probably 15 different treatment programs at this point in her life, was in Portland, Oregon, and she was on a balcony at a party, and she was high on cocaine. And somehow that evening, she fell 8 stories from this balcony onto the street and died. And
Oh my God.
my phone number was the phone number that the police found on her. And so this was pre-cell phone, of course. And so they found a phone number for me when I was in college and called my house, and I answered the phone, and it was the Portland, Oregon Police Department, and said, who is this? And I told them who I was. And they said, do you have a sister named Brenda? And I said, yes. And they're like, we're sorry to tell you that she died, and she fell 8 stories and died. And I remember just being frozen and going, I cannot believe I've lost another sister. I've lost another family member. And so I had to call my mother and tell my mother what happened. And then my mother went into another very deep depression. And her coping skills was using prescription benzodiazepines like Xanax and Valium and things like that. And my sister, who had died from cancer, was prescribed Oxycontin, oxycodone, morphine to help with her chronic pain. And when she died, my mother didn't throw her medication away because she decided that she could use it to numb her own pain, right? Her emotional pain. And so really from birth all the way through college, I experienced just one trauma after the other. And yet something really said to me and spoke to me saying, this isn't going to be your life. And so what I did in college, instead of in high school and college and really throughout school, is I didn't do drugs. I didn't do alcohol or drink a lot of alcohol. I drank socially, but not a lot of alcohol. And I would just put my head down and just study, study, study. And so my addiction really became school, going to school, getting one degree after the other. And then in my early career and moving forward, just work, 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 work. And that just kind of consumed my life. It was work and exercise kind of took over my life to make sure I was healthy and I didn't die like my father did, but yet work to take care of my family. And and then, you know, when I was in college, I decided to go to graduate school because my sister's pain doctor encouraged me. He said, look, I watched you with your family. I watched you with your sister dying. I think you would be an amazing help to other people. And so I did. That's what I did. And that's what I do. And I've done it now for 32 years. But how did I overcome all of that trauma?
Mhm.
Therapy, a lot of therapy. I am one that, yes, I had a lot of trauma, but I also, and I've overcome that trauma, and I help other people with trauma and addiction and medical issues and all types of chronic issues. But I go to therapy every single Tuesday at 10:45, and I meet with a psychiatrist actually, who's a therapeutic psychiatrist. And I think it's so important that as healthy individuals, just like we change the oil in our car and we mow our lawn and we do the dishes at home to keep ourselves up, I think everyone should go to therapy because it's so nice having this person sitting there that's really not connected to you at all in any personal way, that you can sit and just talk about things that are on your mind and talk about feelings and talk about thoughts and hear yourself out loud, and sometimes catch yourself or the therapist catch you and go, say that again and see if that makes sense. So the way that I really overcame it was, you know, I've done a lot of trauma intensives in my adult life. I've done a lot of therapy. I continue to do therapy. I think we should all do therapy, but yeah, that's kind of my traumatic childhood and how I kind of overcame that. And then my career today is really a reflection of, yes, you know, people say people become shrinks for a reason. and and I could say in my own life, definitely my family had a lot to do with my career, and the dysfunction that I grew up in. And so I really believe that a lot of people in this world are misdiagnosed by their psychiatrist, by their physicians, by their therapist, and they're labeled with a diagnosis. And they're often labeled on the first visit in the first 5 to 7 minutes of meeting. And
Mhm.
I think that's a travesty. And so when I developed J Flowers Health Institute, I said, let's each have each person sit with a psychiatrist for 2 hours at minimum, the first visit, sometimes maybe 3 hours if that's what it takes. But you really have to understand the person with whom you're talking, and you have to have empathy and you have to have listening skills, and you have to be able to really get to know and develop a relationship, a good therapeutic relationship of trust with the person that you're sitting across from. And then the rest of the team has to do the same thing, is just develop this trust with the patient that you're sitting with, and then communicate and really talk about that person to be able to properly diagnose. And so I'll stop talking.
So I'm hearing that you are a big believer in talk therapy
Yes. Yeah.
and with, I'm sure, a good qualified psychiatrist. You're specifically talking a psychiatrist.
Not really. No, I'm
Okay.
talking a social worker. I'm talking
Okay.
counselor, licensed professional counselors, licensed master's level therapists, really any mental health professional.
Okay.
You know, by the way, you mentioned before we started recording this podcast that May is Mental Health Awareness Month. And
Yes.
that's so true. I wish every month was Mental Health Awareness Month. We recognize it in May, and I think that's amazing, and it brings a lot of attention to suicidal ideation and depression and anxiety and trauma and all of the mental health issues that surround our world. And this is a good month to recognize that we can help other people and help them find therapists and find a good therapist, and encourage people that it's
Yeah.
not a bad thing. It's a wonderful thing. That stigma of, oh, you see a therapist has really disappeared over the last several
Yeah.
years. And it's become more normal to and accepted to go see a therapist.
It certainly has, but it's also something that is only available to certain people with insurance, and I do sometimes feel like it's the people who need it most don't have necessarily those resources. And that's something I'm on a mission to change. I have no idea how. I don't know where to go with it.
Yeah, yeah, yeah,
Because it's personally affected someone in my life and who actually lives in Texas.
yeah,
So, um, I now understand how difficult it is. And even me, I have insurance and it's still difficult to, still be able to afford those services and take the time to find a good one.
yeah,
Make sure you're getting it every Tuesday. Cause even if you find one, a lot of times it takes a long time to get in to
yeah,
see them. If you don't book way ahead, so I love that you think everybody should see one. And I totally agree. I don't
yeah,
today. I
right, yeah,
probably should. um, Instead, I try to be the therapist for everybody, but I'm not qualified.
right.
Um, but it's yeah, we want everybody to have that opportunity, but I think there's just not enough of them out there, and
Right,
it's
yeah,
hard to get to it. So what do you say about that? How do
yeah.
what is your advice to somebody for that?
I'm so glad you asked me that because I have a thought for you, and then I have a thought for all of your listeners that may or may not be in therapy or may not be able to afford therapy. And you're right, insurance is even difficult to use with therapists these days. And and so the first thing I want to say is when I see my therapist, one of the things that I talked about early on is giving back. And I want to encourage every therapist that may be listening to your podcast to give away 1 to 2 hours a week to people that can't afford it. That would help one life or two lives a week, just or a month even, to really help someone that cannot afford it. And just think if every therapist gave that away, it would be amazing. So I want to encourage your listeners and encourage you that when you're talking to a therapist or you're interviewing a therapist and you're working with the mental health professionals that you may or may not work with or your audience work with, is say, hey, have you thought about giving away an hour a week or 2 hours a week of your time? I know it's a lot, but can you imagine the number of people if every therapist did that? And you'd be surprised at how many of them will go, you know what? I'll do that. I'm absolutely willing to be a resource for an hour or 2 hours a week. And and so I always do that with therapists. And then the other piece of advice that so many people don't understand, and I think it's a travesty that they don't advertise that they do this, but almost, well, no, I'm going to say every single university that has a counseling program or a clinical psychology program or medical school that has a psychiatric program, which they all do, guess what? Every university offers free counseling to the community. And so
No
whatever
idea.
city or town you're in, if there's a 4-year college plus that has a master's program in counseling or therapy or social work or psychology, or then you go on to medical school, every one of them all semester long and even in the summer offers free counseling to the community. And all you have to do is call the school and say, can I speak to your social work program? Can I speak to your counseling program? Can I speak to your psychology program? Because they're different departments. And or a medical school and say, can I speak to the School of Psychiatry? And then ask and say, I don't have the resources to attend my own therapist and pay for one, but can I come in for counseling? And the answer is, oh my gosh, yes. Let's
That's
because
incredible.
yeah. And you don't hear about that.
No, I've never heard that. I've never even thought about that.
Yeah.
That's amazing.
Yeah, I think it's such an unknown thing. And, gosh, I don't even know how many universities there are, but there's thousands of universities throughout the United States and lots of medical schools. And every single one of them give free help and free counseling. And So there is help, and there are ways to get that. And one way is for us as professionals to give back our time. And I call it, look, we feel better, or I feel better, I guess I should say, when I give something away. And if I can give an hour to someone a week or 2 hours a week to two different people, uh, that helps them in some way, then that helps me as well feel better about myself and my own life.
Mhm.
And I would think that that would be the same for other therapists. And when I talk to therapists about it, they always say, yes, I'll do that. And they always come back and say, that was such a great idea. I love doing this. So those are just a couple of thoughts for your listeners.
That's
For, yeah, for
the
you as an
best advice I've ever gotten from
advocate.
anyone when I've brought up that question. So thank you very much for that. That's incredible.
You're welcome.
Um, yeah. So let's talk then a little bit about the J Flowers
Yeah,
Health
health.
Institute, because I know you touched on it a little bit, a very unique approach. And now, is your institute inpatient, outpatient, or both?
So formally, it's outpatient. However, we operate somewhat like an inpatient program, and so I'll get there and tell you why. So in a formal manner, we're considered an outpatient program. So I have patients that really from all over the United States, and some patients really that come from around the world, because what we treat here and what we do at J Flowers Health Institute is really help people understand themselves, their family member, their loved ones, and really truly what's going on. And I mentioned this earlier, but the average psychiatrist in the United States will meet with a patient and diagnose them within 5 to 7 minutes. The average psychologist, social worker, counselor typically does the same thing. And they'll get a preconceived idea in their mind and say, oh my goodness, she has depression, she has generalized anxiety disorder, he or she has bipolar disorder, whatever it may be, right? A personality disorder, a behavioral issue disorder. And then they grab onto that, and that's what they treat. And what I believe is that about 70% of the time, maybe 80% of the time, the diagnosis is incorrect because a proper diagnosis or a proper evaluation wasn't given, the patient wasn't given the opportunity to undergo a really comprehensive diagnostic evaluation. And so when I started J Flowers Health Institute, I put a comprehensive team together, being a physician who does an executive level physical blood work, really does like an annual exam, right? From head to toe, inside and out, and really looks at a person from a medical perspective to see if something may be going on medically that the patient may not have thought about that's affecting their mood or their behavior, right? And then that physician then will make recommendations based on his or her medical findings and say, you know what, we may need to do an MRI of the brain, or we may need to do a CT scan of whatever, the liver, the kidneys, something, the lungs, whatever it is that the physician wants to view more of, or they may want to do some more blood work and look at the volume of medication in a person's body. And then they undergo a psychiatric evaluation with an incredible psychiatrist who will spend very active listening skills in over a 2 to 3 hour period, really looking at all the medical records that the physician previous had seen. And then that psychiatrist creates a vision over that 2 to 3 hours and then makes recommendations together. Those two will meet with a psychologist or clinical psychologist or neuropsychologist and say, here's what we're seeing. Let's see what you see from objective testing. And so then the neuropsychologist or clinical psychologist will do diagnostic testing and look at personality issues, at behavioral issues, at mood issues, emotional dysregulation, whatever it is. And then that psychologist will come up with a set of diagnoses, discuss it with the entire team. And sometimes they get into an amazing conversation where one of them will have a diagnosis in their mind based on what a patient said or what a patient's history is. And then that other professional, being a neuropsychologist or psychiatrist, whatever the other person is, and say, I agree, but did you hear her say ABC? It's like, oh my gosh, no, I didn't know that had happened to her. I think that diagnosis is incorrect. Let's go with this one. Then they move into nutrition evaluations. We want to look at how a person is eating in their life, what kind of food they're eating. People who have long-term chronic pain syndrome often have really poor diets. People who are depressed and have behavioral or personality issues or schizophrenia typically eat very poorly because they don't think about their nutrition. They're not exercising. They're not living life in a way that's productive, in a way that takes care of their body, right? So we want to look at their nutrition and have a proper nutrition evaluation. And then they'll move into what we call brain mapping. And it's done with EEG, neurofeedback assessments. And we look at the brain and over 200 parts of the brain simultaneously while the patient is undergoing a verbal and eye movement test to solve problems, to solve thinking, to solve short-term memory, long-term memory, and really look at how a person's brain works under stress, right? So solving mathematical problems, solving word problems, word finding problems, or recalling letters backwards or numbers backwards, which I even have a hard time with. But um, but then this team meets every single morning and says, here's what I saw with John. Here's what we see with Amy. Here's what we see with Sally. Now, let's talk about it as a team and see if we all agree or if there's differences of opinion and why. And so over a 10 to 14 day period, we can develop what I call a living behavioral life MRI. So it's as crystal clear as a true MRI that's looking at a knee or a brain or an x-ray that looks for fractures. And it creates this image of this person over 10 to 14 days that we can hand them a booklet or a book with all of their evaluation results in it and sit with the family, the referent, whoever the patient is willing to have sit with them and go through this and say, here's what we see. How do you feel about this? And it is amazing to see people sit there and go, I had no idea. That makes so much sense in my life. Now, how do I treat it? Right.
Yeah.
So not only do we come up with the diagnosis, but we come up with a treatment plan and a roadmap for health. And then we make recommendations. Are we the right program to work with you and our team? And if we're not, let's look at 2 or 3 other programs near your home or around the country that are really well qualified that can help you most efficiently, right? And work with you within your means and ability to work to be able to live that life that you really want to live. Because like my mother said when I was small, you can achieve. And I do believe no matter what's happened to our patients and their lives and our backgrounds, if you want to achieve something, I am an example of someone that you can achieve that, right? It just takes work and it takes effort and it takes a team of caring professionals that can really help guide you there and teach you how to achieve that. And so that's what we do at J Flowers is first we diagnose and then we either treat or we create a plan for treatment that works in their home region or wherever it is in the country that would be best for them.
That is so unique. Are there any other places out there that do this?
So I'm going to be very bold, and I say this to everyone that asks me that question, and the answer simply is no.
Yeah, I don't think I've ever.
Yeah, there are amazing assessment programs around the country, but here's the difference in what we see mostly in this country is, there's incredible psychiatric programs that really focus on behavior and psychiatry. And then there's addiction programs that specialize in addiction, but not so much trauma. they really want to do a hardcore 12-step program, which works for many people, but a lot of times you're missing everything else around it as to what's the root cause. And then there's other types of programs that focus on their specialty. And we treat people in these silos. In other words, we treat addiction, but let's not work on anything else. Let's treat their psychiatry or their borderline diagnosis or their bipolar diagnosis, but don't worry about our physical health, right? Or we treat other things. Let's not worry about, let's work on her medical health, but not worry about the depression that she's experiencing because of her medical issues. And so what I did is really created this program that encompasses all of that. Because if you don't work with all of that and look at all of that, you may do well for a short period of time, but the relapse rate and addiction treatment programs is huge in this country, really around the world. And it's because they really don't look at the totality of a person's life.
Yeah, I've talked to several people who have overcome alcoholism or drug addictions and say that it's, I couldn't overcome my trauma until I overcame the alcohol addiction, right? Like a lot of times we think of they're drinking because of the trauma. So you solve the trauma and that'll get rid of the alcoholism.
Right.
And then it doesn't work that way, right? Like, let me work on this alcoholism and then then I can work on the trauma, because it's a vicious cycle almost. Yeah. So it's awesome, the approach that you're taking. And how did you come up with this approach? What was your background that got you to this place?
Yeah. So really, it was truly a few things. One was the death of my sister from cancer. Two was the death of my other sister from addiction. Watching my father die in front of me. And as I grew up and was in undergraduate school, I thought my degree was in marketing and finance, because I thought, oh, I'll go work in a bank or I'll do real estate or something like that. And then when my sisters died, and I met with her physician and I was talking to him about my sister dying, and he was asking me questions about what I was going to do next. And he became somewhat of a mentor. And he said, and encouraged me, he said, you could definitely pursue a business life, but I really think you have a skill set. And I really think you should look at this unique program. And so I ended up in graduate school really focusing on chronic disease and from a psychological and counseling perspective, really looking at life from a behavioral issue, but also realizing that so many other components of our body affect the brain. And so from day one of graduate school, all I studied was complex disease processes and mental health and chronic pain and how they affect each part of our body. And then how to treat it. And then I did a fellowship in that, and then helped programs around the country create these programs of assessment and evaluation. Unfortunately, sometimes they stayed after I left, and sometimes they shut them down after I left and went on to the next place. But I really created this based on my personal history, watching my sisters die really from cancer and addiction, and my parents, but also knowing that working in this field for 32 years now, watching the addiction and watching the repeat business and treatment programs and psychiatric programs, going, this is not okay. We're not doing a good job. We can do better. And the only way we can do better is by creating a collaborative team of people and actually communicating and talking to each other and discussing the patient, not just seeing a patient and then uploading it to the chart and walking away.
Right. I want that in my life just for my physical health. Like,
Yeah.
I have so many different things going on, and I got to see an eye doctor, and I've got to see a neurologist, and I've got to see the primary care, and maybe the, orthopedics. Can't I just get them all in a room like that? I want that in my life.
And that's what we do. Yeah. That's what we do. That's how we do it.
That's amazing.
Yeah.
I love it. I had a question. It's going to come back to me. Oh goodness. Oh, I hate that
That's all right.
I remember. Okay. So pretty much any of us in life, we go when life just throws things at you, right? There's always going to be stressors. There's always going to be things that happen that are traumatic on different levels. Why do you have any theories of why one person may handle it like you and your sister, right? Grew up in the same family, had the same experiences. You took a different path than she did. Is there something?
Yeah,
Why does one person go one way and another person is more able to, you know,
yeah,
handle it? And I know you did mention your addictions
yeah.
of studying and
Yeah.
the physical, exercise.
Yeah.
So is it just you also have addictions? You just
So
process them in a more healthy way?
yeah, first of all, what I'll say is if I could truly answer that question, I would be a billionaire.
Right.
Or
Yep.
at least a Nobel Peace Prize winning
Right.
therapist, right? But the thing is we just don't know. I do believe that addiction and mental health obviously runs in families, and it can be hereditary. Addiction can be hereditary. Psychiatric issues can be hereditary. I also am a big believer in nature versus nurture,
Hmm.
and nature being the hereditary component of it, and then nurture being the family or the surroundings that the person surrounds themselves with. And I really think that some people are born with a natural ability to cope with stress and trauma, and some people are born with almost an inability to handle stress and trauma. I know probably in your own life, you have friends or family members who can be tough as nails in crisis. And then people that when crisis happens, they just fall apart and crumble, right? And we really don't know why, other than we are born the way we're born. And and we can change, and we can change that by doing therapy and learn coping skills and ways to help our own anxiety and trauma. But I think it is oh, what word was I looking for? I was looking for a particular word. Whether it's luck of the draw or whether it's, what. I just think that some of us are born with the ability to have coping skills better than other people. Yeah.
Yeah.
So a little bit of nature, a little bit of nurture, and then I think, unfortunately, the word luck.
Right. Yeah. And I
Yeah.
think that, even though you and your sister were born into the same family, she was older than you, right? By how much I'm not sure, but
Yeah.
um she had different experience. She was exposed to different things. You had that time with your grandmother.
Yeah.
Did she ever have
It,
that time?
you would no, she didn't. And so
Yeah.
for me, that nurturing part from
Yes.
her, I would sit with her for an hour every single day for lunch. And we had the best from the time I was in like second or third grade until I was in eighth grade.
Yeah.
And uh and I loved that time. And then the other component was my great grandmother. Sometimes on the weekend, I would go spend the night with my great grandmother in her house. And I can remember laying in her bed at night and her telling me stories about heaven and what heaven looks like, and talking about the golden streets and, all these beautiful things in heaven. And we would lay there and just visualize it together. And that nurturing and that love that she gave me, I think also saved me from a
Right.
potential disaster. Yeah. So I think
Yeah.
you're exactly right. Nature, nurture, all of that plays
Yeah.
a role.
All of that. Yes. So I like to ask people, where do you think your strength comes from?
Yeah. Well, I definitely think God, number one. I think that he gave me the ability to be resilient. He helps me be resilient. I think that I think I get a lot of my strength from my mother, even though she was ill in mental health and addiction. She was the most resilient woman I've ever met in my life. And she overcame her parents' death, my father's death, uh, two daughters dying, twins that she
Yeah.
carried for 9 months and died at birth, and yet she lived her life. And a lot of people would have committed suicide at that point
Yeah.
and done
Yeah.
even worse things. And so I get a lot of my strength from that. And I get some from my grandparents. And so I get it, I think, nurturing from my family. And then I also get it naturally. And I think from God, really.
Yeah.
Yeah.
That's awesome.
Yeah.
Well, I know you have a hard stop, so I will just give you one last opportunity to share whatever you'd like to share
Yep.
about your institute, how people can reach you,
Yeah.
any advice you want to give. So
Yeah. First of all, if anyone wants to reach out to me, my website is J, like the initial J, flowershealth.com. So jflowershealth.com. And I'm on the website with my email address, and you can email me, and I always answer my own emails, and I would be happy to help and talk to anybody, really. And what I would say is I think that what you talked about is so important, of helping other people and being an advocate for people that can't afford therapy and can't afford to get help, is reach out and ask for help. Because there are ways. Ask a therapist if they will give you. Simply calling a therapist office, even sometimes, or going to a therapist office and saying, I can't afford therapy. Will you give it to me for, half off or 70% off or whatever you can afford? And so many therapists will work on a sliding scale as well. And then asking our colleagues and our friends to give back in a way, not necessarily with money, but our time. And time is valuable, and it makes you feel good to give valuable time back. So give an hour or two a week if you can. And if you're struggling, reach out to a therapist, reach out to your family, reach out to your friends, and don't have any shame in asking for help. And just know that this profession is here for you. And May is Mental Health Month, so I hope that you get this word out. I know you will. And I appreciate your podcast and think that it's so invaluable to so many people.
Thank you so much.
Yeah.
It's been an absolute pleasure speaking with you, and I thank you so much. And I'm going to give you 10 minutes back in your day.
I love it. Listen, thank you so much for your time and having me. I hope we get a copy of this. And so
Absolutely. Yeah.
I guess you'll send us a link or something, which would be
Yep.
amazing. And then I do a podcast, and I'd love to have you on my podcast. So
That would be awesome. Yeah. Thank you so much. I appreciate that.
You bet. All
I
right.
haven't done a lot of guesting. I have my first one, not this weekend, but next weekend, my first guesting on a
That's so
podcast.
cool.
So,
Yeah.
yeah.
How long have you been doing this?
I'm going on 3 years doing this, and
Yeah.
it just like organically started randomly. I'm like, I felt a need to do something.
Yeah.
And it was actually a conversation with my boyfriend in the hot tub. And
Wow.
it turned into 3 years now of doing this podcast. And
That's
yeah, it's been amazing.
I love it. That's great. Well, we'll talk soon. Thank
Yes,
you.
we will. Thank you very much. Have a good afternoon.
I hope it was what you were expecting and wanting.
It was more, way
Okay.
more. Thank you.
Bye.
Bye-bye. I just want to say thank you so much for tuning in to Without Regret, the podcast. I really appreciate it. And I'd like to ask you to please like and subscribe. Leave me a review wherever you get your podcast. That would be really awesome, because that's how my podcast is going to get noticed. So that would be a huge help, or share it on your social media would be awesome as well. Thank you so much. This podcast is a Without Regret production, which is produced by me. Artwork is by me. Everything's by me except for that theme song. That's by a guy named Michael Bruguglio. You can follow us on Facebook at facebook.com/Without Regret Podcast, and on Instagram at without_regret_podcast. Thanks again.